Routine screening tests are critical to women's health. Doctors are much more capable of successfully treating women if diseases and other illnesses are detected early on. Now, we are talking more about that in today's Living Healthy segment. We welcome in Dr. Emilie Stickley from Adventist Health Castle. Hello, doctor. Thanks for joining us.
Hi, nice to meet you.
So what are some of the most important screenings that women should undergo every year?
Well, it's important to kind of look at screenings based on age. When we have young women that come to us, we're thinking a little bit differently, more towards screening for things like sexually transmitted infections, which we should do at least once a year. As women get older, we move more into considering, cervical cancer screening with pap smears, mammogram screening once a year starting at age 40. After age 50, we move into things like colonoscopy. And then as women get older, we worry more about bone density and osteoporosis, so we add screening with the DEXA for the bone density. We also take into considerations things like just high blood pressure screening and lipid screening for cholesterol, keeping track of the vaccinations to be sure that the vaccinations are up to date.
Yeah, that may seem overwhelming because there's so many things that we should get screened for, but really just have a relationship with your doctor and hopefully they'll send you these reminder cards, right? But like you said, it depends on your age,
yes,
right, and what
absolutely.
you're going through. You did mention pap smears, and if I remember correctly, hasn't the guidelines changed?
That's correct, and that's one of the reasons, when you mentioned that it seems overwhelming with the screening, pap smear guidelines have changed, and so now we are only doing the pap smear for most women every third year. That got a little bit confusing because then women stopped coming to see us once a year for their annual exam, and as you can see, there are a lot of other screening things and just part of the physical exam that we like to do every single year. And so we still want women to continue coming for their well woman exam, understanding that the pap smear only needs to be done for most women on the third year of that visit.
Okay, thank you very much for clarifying that, because you're right. A lot of women, they know how important the pap smear test is, but they think, oh, okay, if I don't have to do that till every 3 years, then everything else can also wait.
Exactly.
Okay, thank you for that. I also read something about a Gardasil vaccine. What is that?
So the Gardasil vaccine is the first vaccination that has been FDA approved for the prevention of cancer, and that's what is so amazing and cutting edge about this vaccine. Is everyone talks about, oh, we need a cure for cancer. Now we have an actual vaccination to prevent cancer, and it prevents cervical cancer. It also prevents genital warts, and so it's kind of getting two things covered in one vaccination. This vaccine is a 3-vaccine series, and it covers the 9 most common strains of HPV. Previously, it covered 4 strains, and now it covers 9, so it's gotten even better.
Wow.
This vaccination is only preventative, it does not cure, and so that's why it's important to consider this vaccine in girls and boys starting around age 9 to 11. Once children, teens, young adults get exposed to HPV, which there are 14 million new cases of HPV every year. Once that exposure happens, the vaccine will not work. And so it's important to complete that series prior to the first exposure to HPV.
Okay, is this the one, there's a commercial going out there where okay, it's a very powerful commercial.
It is, yes.
It's a child that grows up and they're blaming their parents for whatever, happened to them. But that's what this is about.
And I think a lot of parents are always thinking, why would I do it, prevention for sexually transmitted infections in my 10-year-old. But I think if you think about their entire life and their entire future in the next 70 years of their life and what you can do at age 9, 10, or 11 to prevent cancer and genital warts for these young people, as they get older, it's very important.
Absolutely. As a responsible parent, right, don't you want that for your child? Also, let's switch gears a little bit and talk about birth control choices. There are so many choices out there. How do you help a patient choose the best one for them?
Yeah, I think the most important thing is establishing a good relationship with your patient so you really know what they need when it comes to birth control. Of course, you want to rule out any reasons that they couldn't use certain types of birth control. Smokers or high blood pressure would limit the types of birth control we can use. And then also if they have certain types of birth control can actually prevent certain types of cancer. And so for women that are prone to ovarian cancer, we may consider using different birth control for them as well. Then I consider how long of an interval they want before they're planning a pregnancy. For someone who says, oh, I think I might want to get pregnant in 6 months, we might consider something different than a couple that, you know, is not planning to conceive for another 5 years. You know, we have a lot of long-term options that are very good. Or a teenager that's going off to college, you know, is going to be busy and have late nights and early mornings and studying and trips, you know, with a sports team. A daily pill may not be a great choice. And so we have a lot of long-term, easy options. And so those are all factors to take into consideration.
We are out of time, but I could talk to you forever. This is a very interesting topic, a very important topic for all of our viewers. So thank you very much.
Absolutely.
If people want for information, where can they find you?
So I work at Poly Women's Health Center, and we are located in the professional building right next to Castle Hospital in Kailua.
Okay. Great. Thank you so much, Doctor. This is very important. We're going to have all of this information on our website as well.